Hello,
Now,
everybody.
hi. And then I'm gonna go live.
I'm
These platforms change. Hi. Um, Here we go. Live.
oh, you got it? Good girl. Wow. Everything's changed on
Everything keeps
Instagram.
changing. Yeah, everything keeps changing. All right,
Uh,
we're live on Instagram.
I don't see us live on Instagram.
Hi.
Oh, I know what I have to do.
Happy Friday. Let's see. Hello, hello, welcome in.
There we go.
Hi,
Oh.
hello. How are you guys doing today? Happy Friday. Thanks for the hearts. All
We
right, I
need
got
them.
my yeah, we need the love.
Okay, I requested to get onto Instagram.
And I got Dr. Q's request.
Oh man.
All right. Oh my gosh, look at our first question already. Y'all don't play. Thank you. We can get right to it.
How
We can
did
get right to it. We already got our first question. But while we're answering the question, I want to know where you guys are tuning in from. Let us know so we can shout out some of your cities or countries. Did hydroxyurea change your skin? Is that a question for me? I'm
Must
assuming
be.
it's
It must be. I'm not.
or is the question, does hydroxyurea change your skin? Does it
Oh,
change your skin, Dr. Q?
I don't think so. I mean, it changes your nails. Trying to think. I don't think so. I don't think it does.
Okay. Yeah, I don't think it changed my skin. I am on hydroxyurea. I'm looking at my nails right now so I can show you what it does to your nails, but I don't, can you all see that like
Boy.
little line there? Oh wow, it shows up really well on the camera. You see that? I promise it's not this exaggerated in real life.
We have a lot of people calling in from Africa, Kenya,
That's
Ghana.
awesome.
Yeah.
Oh, you're about to start it today and you're scared. Don't be scared. I know it can be scary to start hydroxyurea, but think of this as like vitamins for your sickle cell. That's how I think of it. And one of the, I guess the selling points for me was that hydroxyurea extends your life. So it reduces mortality in sickle cell. So that alone, I was like, say less, say less. And it protects your org. It does that by protecting your organs and, a bunch of other things that I'm sure Dr. Q could explain. But I can understand it being scary starting a medication, but you should also kind of look at it as a opportunity to um, kind of wrangle in your sickle cell a little bit and make sure it stops doing the damage that it does, or at least slows that damage down a little bit. But yes, that's my nail. That's the line on my nail that hydroxyurea causes. And if I get tired of seeing that line, I just go to the salon and get my nails done, and then I don't see it anymore.
Good
So
excuse.
yeah, good. It's always a good excuse to go to the salon. Dr. Q, anything else to add to that?
Uh, Hydroxyurea is very, very safe, but you do need to have someone prescribing it who knows what they're doing so they can order lab tests every couple of months just to make sure everything's okay because it can reduce your red cell count, your white count, which is expected that it should reduce your white count because and it helps because white cells are involved in vasoocclusion. So if you reduce your white count to normal, people with sickle cell disease, because their bone marrow is so active, they have a higher white blood count than people who don't have sickle cell. So this put your white count down to normal. It can increase your hemoglobin because you make fetal hemoglobin, which protects your cells, so you're able to have a higher hemoglobin. Um, and when they do studies now, they have so many people take hydroxyurea that they can't use that as an exclusionary uh, reason not to enroll people because they wouldn't have anybody to enroll. So a lot of people take hydroxyurea. It in children, it prevents strokes. Uh, it just it's the oldest drug and it's the most effective right now for sickle cell disease, unless they come up with some new drug.
All right. I see Accra, Ghana, Nairobi, Kenya. Thank you
Yeah,
guys for
look at
joining
that.
us. I see some Canadian flags. Awesome. And then I see we always have Pennsylvania in the house. Thank you always for being here. Here in Pennsylvania, currently hospitalized due to sickle cell anemia crisis, 56 years old. I'm so sorry
Oh,
to hear
wow.
that. I hope get better soon. 56 is amazing. You'll have to share your secrets. Somebody else said it didn't change my skin. What are the side effects of you being on hydroxyurea? Some of that side effects are the nail discoloring. Any other side effects to call out, Dr. Q?
It decreases your sperm count in men. So you're not sterile, and men with sickle cell disease have a relatively lower sperm count than people who don't have sickle cell disease, and this decreases it a little bit more. But you're not sterile. Once you stop the hydroxyurea, like say you and your partner want to have a child, so that it's recommended that you stop hydroxyurea, that your sperm count goes right back up again. It's a temporary thing. Uh, that, the nails, some people say they lose hair, um, although I never saw anything that I could tell. Um, those are the major side effects. Besides taking too high a dose and your white count and your red count goes down. So in children, they're growing. So usually they're on too low a dose because you start some somebody on their first birthday or something, and by the time they're two, they're much bigger. So you have to if you want to have an effective dose in kids, you have to monitor their weight and change the dose around. And in adults as well, if you put on weight or lose weight, you might have to get your dose changed. But the only way you can know that for sure is if every couple of months you have your complete blood count done so that the and and a fetal hemoglobin to see how it's doing to make sure everything's okay with the dose that you're on. And I had patients who their hemoglobin would go down or their platelets or something, and I would stop it for 2 weeks. And then if everything looked no good in 2 weeks, I would restart it and then check again. And I never had to, stop it because they still had problems.
Dr. Q, there's a follow-up question here that's can my 5-year-old son use hydroxyurea? I'm joining from Nigeria.
Yes. Here, it's recommended that you start hydroxyurea when children are 9 months old. So for sure, a 5-year-old could take hydroxyurea. Um, it is a pill, so you have to crush it up if you can't swallow it and put it in something for your child to be able to take it. But otherwise, um, yeah, a 5-year-old be a good good person to start. The other, and you just have to make sure you've got access to have your blood counts done on some kind of a regular basis, just to make sure everything's okay.
Okay, there's somebody who's asking people, has anyone here took Oxbryta? What was your experience with taking it? And then I do see comments of people talking about their experience, but I wonder why you
Yeah,
um, ask about it, taking Oxbryta. As you all may know, it is withdrawn from the market, so people cannot take it anymore. So if there's any other questions you have surrounding Oxbryta, or any follow-up questions you have around Oxbryta, let me know or let us know, and we can delve into it a little bit deeper. But it
yeah.
does look like some people are answering what their experience was for taking Oxbryta. What does your current diet look like to maintain? What should your current diet look like to maintain health with sickle cell? I think this was a question for me, but I'm not a shining example. So I want Dr. Q to tell you
You
all
look like a
what good
shining
looks like.
example.
To share what good looks like, so we don't have to refer to my bad eating habits.
I find that hard to believe. So people with people with sickle cell disease should eat what some people call a Mediterranean diet, which is fruits, vegetables, nuts, not no processed foods, and that includes like meats that are processed. You can there's nothing. I'm a vegetarian, so that's why I'm hemming and hawing. So there's nothing wrong with meat, and you should eat some meat, but you shouldn't overdo the meat part. Chicken, stuff like that. But basically, it's and a lot of fluid. You got to drink a lot of water, especially if you live somewhere where it's warm. That is key. And you have to have you children with sickle cell disease tend to not grow so well because when you have sickle cell disease, a lot of your bodily energy is used up making red cells. And when kids are growing, their bone marrow is really super active. And so their diet has to be, not, it has to be able to maintain their weight and be healthy. Once you get to be an adult, your metabolism kind of levels out. And so once you get into a routine with your diet, then um, you should be okay. I don't, you, if depending on your diet, you really don't need to take any like multivitamins or anything like that. In the past, people have recommended folic acid, and that was before, at least in the United States, everything, all breads, all cereals are fortified with folic acid. If you're in another country, that may not be the case. And if it's not, or you're not eating any kind of cereal or bread or whatever in this country, then folic acid wouldn't be a bad idea. It does help you increase your hemoglobin if you're deficient. So that's another thing to think about. But you don't need to take a lot of vitamins and stuff.
I see a comment here. I think it's about hydroxyurea. It says, I don't believe that sickle cell men have lower sperm counts. Both of my children, a mother got pregnant. Um, you could have reduced sperm count and still get somebody pregnant.
Oh
It
yeah.
only takes one sperm to get to the egg. So even so
We're not
sickle,
talking about really low. It's just lower
yeah.
than people who don't take
So
hydroxyurea.
people with sickle, I think what this person was saying is people with sickle cell have lower sperm counts already.
Right.
And then also hydroxyurea can lower that sperm count. But even if both are lower, it doesn't mean you're infertile.
No.
You could still have low sperm counts and impregnate, a person. So, just wanted to make sure that was clear. Um, uh, Doc, hey Doc, do you recommend doing a stem cell transplant? I'm afraid of the cancer part.
Uh, if you have the most optimum thing, we have a sibling who's an HLA match to you. That means you and your sibling both have the same parents. And even in children, that is like the recommendation. But as you grow up, your sibling is still the best donor if they would do that. Then after that, you get HLA match donors, which the biggest thing is not cancer from a bone marrow transplant, but graft versus host disease, which means that the before you get your transplant, they give you medication, conditioning it's called, to kind of decrease the number of cells you're making in your bone marrow, and they call that making space for the transplant. Um, and then you get somebody else's uh, progenitor cells, and they start growing in your bone marrow. Those cells could see you as foreign and start having an antibody kind of reaction against your body. So that's graft versus host disease. And nowadays, there's a lot of, there's been some changes in the way they uh, do the transplant following the induction once you are have it to really reduce graft versus host disease. So that is not as big a problem, but if you do have graft versus host disease, that's the biggest problem. Cancer, I don't, it's not that common. It was in gene therapy. There was some cancers from busulfan, um, but two or three cases. So those
Dr.
weren't
Q, we
bone
can
marrow.
hear your pen
Oh, sorry.
clicking.
My
No worries.
nervousness. I need one of those little,
You need a fidget
yeah, I need a
spinner or
fidget.
something.
So, um, so in the gene therapy, it was the conditioning was a little bit different, and it's a whole different procedure. But what you need to do for if you have a donor and you want to get it and you're even thinking, you must be thinking about it a little bit. You need to make an appointment and talk to the transplant specialist, who should be somebody who's done transplants in people with sickle cell before. And you should have it done in a hospital where there are sickle cell doctors, because that all those people need to get together to have for so you can have a good outcome.
Is
There,
this a general Q&A? It's a general Q&A, yes, for sickle cell
yep.
related Q&A. Um, Let's see. There's another bone marrow question. My son's doctor is against doing a bone marrow transplant because we are all half match. I am 7 out of 10 and the siblings are 5 out of 10. My understanding is that half match transplant is more common and considered standard of care. Why is the doctor against BMT for half match? Also, there are research showing that the risks are not much different.
Well, I don't need to tell you anything.
Yeah.
I have
Mhm.
no idea. Well, yeah, you're totally right. The way they've do the conditioning and everything, the risks for a HLA half matched bone marrow transplant are similar to a unrelated fully matched donor. Um, and so, there's always there can always be issues with transplants or gene therapy or whatever. So you have to, if you understand the risks and you know that you're willing to take the risk, then um, you should, I think you should really explore that maybe with whoever does the transplants where you live. And like I said, it has to be it has to be a hospital where they have a transplant doctor who's done this, especially with a half match, a doctor who knows about sickle cell disease, has done transplants like that before, and there's support. You need support to be able to do well in a transplant. So um, those are the things. But there's risk involved in everything. So when you sign a consent for a transplant, make sure, or anything, make sure that you really understand the risks, what the risks are, and you're willing to accept those risks. Um, because in medicine, nothing is guaranteed. Things happen. Most of the time, things go okay, but as doctors sometimes say, things happen that are unexpected, and in medicine, that could be bad, but they're rare, very rare.
Fine wine and V, could you, thanks for the message. I'm just getting to it. Could you repost your question if we haven't already gotten to it? And let me see if I can scroll up to see if I see anything. Oh, okay, that's the question we just answered. Hopefully, you got clarification. That was the question. Okay, perfect. Um, and she said that they prefer to wait to see if his sickle cell is severe. I thought the younger the better. It is the younger the better.
Yeah.
Um, so you're right with that. So, I mean, if somebody's so hesitant in exploring that with her, what would you recommend, Dr. Q?
Well, I think, the younger the better. If you have especially if you have, if you've identified a donor, or maybe it's, you know, especially if it's a sibling, then the younger the better. Like if you have an HLA matched full sibling, people want to do the transplant when you're a year old or maybe
He's
younger.
two. He's 2 years old.
Yeah, so um, that's I think that's reasonable. A half matched in a 2-year old, you'd have to, again, you need to have a really experienced transplanter and support for that. Um, uh, but that the idea behind a transplant is you do the transplant before there's any organ damage.
Yeah,
You
yeah,
don't want to do a transplant after you've had an AVN or you've got some kind of liver problems or whatever, because a transplant, it does improve some of those things, but it's better if they never happen.
right.
And the other thing I think you might talk to a transplanter and they may say the same thing. Well, he's only 2, he hasn't had any trouble, blah, blah, blah. But you just have to be on board with that and be in line to
Well, it's
find
it's
out what it
from
is.
it's from 6 months to 2 years where the fetal hemoglobin drops off. So she
Yeah,
doesn't have an accurate representation of how severe the sickle cell is because fetal hemoglobin could still
yeah,
be
right.
present. So maybe that's part of their concern too.
That I had a I had a grandmother who had a little her grandchild, and she was the primary caretaker, and she was very concerned about fetal hemoglobin. So every time we did a routine lab, we did a fetal hemoglobin just to make her happy.
Okay.
I used to do stuff like that.
Yeah.
And her this is a a study of one kid, but her grandkid had fetal hemoglobin at reasonable levels until she was about 2.5. So you don't you the younger you start having problems, the more severe your sickle cell disease is going to be.
Do you
And
do you-
most kids don't really have problems until they're
yeah,
maybe 3 years old, two and a half,
3.
3 years old.
Yeah.
That's like, but they can have, by the time they're 4 or 5, almost every kid who has hemoglobin SS or S beta zero thal has had some kind of a problem. So,
I love the questions you guys are sending today. Like
yeah.
a lot of these are very unique. Um, do you know the success rate for the half match?
The half match is the success rate is comparable to full match.
It is?
Um,
Okay. Which is
it's
high.
it's not exactly the same, but it's comparable. It's like a few percent difference in success.
Okay.
It's not like it's half as good. It's
Yeah. Okay. Just want to make sure. Am I late? What did I miss? You are not late. You are right where you're supposed to be. I is half match transplant standard of care. My son is getting. Did that answer your questions? Thank you for answering. Um, just kind of going through these comments here. Somebody talking about their hydroxyurea. Did I answer your question? Hopefully that answered your question. All right. So the next question I have here is X Jade harmful in the long run?
no. I mean,
N-
no, I mean, iron overload is much worse than the medication, and that's why it's given. So, uh, as long as you're iron overloaded, XJade is fine. If you have to monitor, if you're on chronic transfusions, then you're going to be on XJade for as long as you're on transfusions. But if you were on transfusions, you got really iron overloaded, and now you're not on transfusions anymore, then you do have to monitor your iron to make sure you're not taking XJade when you shouldn't be because your iron is so low or negligible. But as long as you're on transfusions, you're iron overloaded, you should be on XJade. Iron overload is so insidious. There's no symptoms, but your liver, your pancreas, and your heart are all being damaged by iron. And even your kidneys, that's on a lower level, are being damaged. So iron overload is really bad. And I've known too many usually early adults who have died from iron overload. It takes a long time. So
Yeah.
people don't die when they're 10 or 15 or 16. They die when they're 20, 25, something like
Mm,
that. It's really, and then once your iron gets up to a certain point, if you've sort of been not, as doctors say, not compliant, then it's really hard to get that iron down. It's really, once your ferritin and your liver iron and your total body iron is really high, getting rid of that iron takes a lot of intense therapy. It can be avoided if you just start taking XJ when the doctor recommends it, when your iron overload isn't too bad.
Um, yeah, I can't stress enough. If you've had over 10 transfusions, you should be tracking your ferritin
Right.
levels. And Dr. Q, you mentioned in the past, if you're chronically transfused, you should be checking your organs via MRI to make sure that there isn't iron buildup within those organs. It's very, very, very important. I can't stress that
Yeah.
enough. So,
And even if you say had you're on transfusions for some reason for 6 months, or even if you were pregnant and you're on transfusions during your pregnancy,
mm,
you need to make sure that your ferritin is not a great way to check your iron overload, but for you personally, if your ferritin's going up, your iron overload is getting worse. If you want to know exactly what's going on with your iron overload, how much it's affected your body, then you need an MRI. But
yeah.
as a kind of screening test, ferritin is okay. And if you just want to know what am I iron overloaded because 3 years ago or whatever, I had a year of transfusions or something, then the ferritin's okay. If it's really high, then you do want to have an MRI just to see how things are doing.
Yeah, so
And
please
if
take
it's,
your X-Jade.
yeah,
Please
it's
do.
it's a lot easier to take your XJ every day when you get it prescribed than waiting for 3 years and having severe iron overload when you've already have damage to your organs and you're trying to get that down. It's really hard. It's not easy to get high a high level of iron in your body down to a normal level.
Dr. Q, did you by chance work at the Sickle Cell Outpatient Center in Oakland?
I recall, yes, that I did.
Yes, that is the same Dr. Q, Dr. Keith Carollo. And it sounds like you're local, Princess Goonalot.
Yeah,
Goonalot. Yes. That is the Dr. Q.
yeah,
Um, Hello, in what pharmacy or place can I get hydroxyurea? Where are you located?
yeah, right. In developed countries in Europe and the United States, Canada, whatever, you should be if you're prescribed, you should be able to get it at a pharmacy.
Yeah, so it just really depends on your location, whatever country you're in. But yeah, here in the US, you can get it at any pharmacy. It's
Right.
pretty common.
But just getting the medicine, that's you need it, right? But you need to have somebody monitoring it. You can't,
Yeah.
hydroxyurea is not the kind of medicine you just start taking like vitamins. It's not okay to do that. You need somebody to be monitoring your blood counts and making sure it's safe for you.
Hi,
And
do you
go ahead.
Oh, did you want to ask
No,
something or add
no,
something?
no, I'm good.
You guys, I love the questions today. They're so different. Um, Hello. Do you recommend herbal medicine and treatment?
Uh, I can't or recommend herbal treatments because they're by nature they're a conglomeration of stuff that you don't really know what it is. It's not checked by the FDA. It's not checked by anybody, um, and you don't really know what you're getting. So a lot of people take herbal medicine and stuff like that, but um, it can you don't know what's in it, so it can damage your body. So I was reading an article about people who without sickle cell who take herbs and stuff like that. And one of the big problems within that group of people it was that they had liver damage from the medicine they were taking. That was the most common problem. So I can't really recommend taking herbal medicine unless you know exactly what it is, which you probably can't. But if you are taking it, make sure you tell your doctor you're taking it because there are contraindications to be taking herbal medicine depending on what you're taking otherwise.
All right, y'all want to know about the treatments today, the disease modifying therapies today. Hey, doctor, what is your thoughts and opinions on Adakveo?
Adoxio. Now I gotta say I have to look in my what Adoxio is. I don't go
It's
what.
the crizolizumab.
Oh, crizolizumab. Oh, it I it, it's it there was a big study in Africa. And the people on placebos, meaning they were not taking active medication, and crizolizumab had exactly the same outcome. There was no difference between not taking crizolizumab and taking crizolizumab. The problem with that study was this is my own personal point of view, was that it was a little bit big and they're in a country where the healthcare is not that great. And they gave it to, I can't remember how many people were in the study, but it seemed to there were a lot. It seemed to me that they would have a hard time making sure all those people were actually taking the drug. So, but on the weight of that study, that the placebo and crizolizumab were exactly the same, um, the equivalent to the FDA in Europe no longer recommends that medication. Um, There's another medication similar to crizolizumab that was in development and it failed there's three phases to a study, one, two, three. It failed the phase two study. And so the company that was making it just stopped. So um, those types of drugs may not be very effective for people with sickle cell disease. So,
Okay, I have a follow-up question to the person who's asking where to get hydroxyurea. This
mhm.
person is in Panama. So he said, I'm in Panama, but I have family in Florida and they can help me in getting the
Oh,
hydroxyurea. Here in Panama, it is difficult to find it and it's kind of expensive. The only thing I would say back to that is yes, and I have my family doctor and always monitoring my health at least 3 times a year. So yeah, I'm glad you said that because that's the thing is with hydroxyurea, it has to be followed on, when I started hydroxyurea, I had to be followed on a monthly basis. So 3 times a year wouldn't be enough to monitor it and get labs for hydroxyurea. So as long as you have somebody following your counts, because your counts can go berserk and it can, and that's happened to me before, but the only way that was found out is through my lab. So you have to have your labs reviewed routinely. Now that I'm stable on hydroxyurea, I do labs once every 3 months, but and that's the least amount of I guess time in between um that's the least amount of time to not get labs is you have to at least get it every 1 to 3 months. So that's the only thing because that needs to be monitored.
yeah, and you have to find a doctor who knows something, who knows what to look for in the blood counts. I mean, if they it's easy enough as if you're a doctor to just read the literature and find out, but that person has to be feel confident to them in themselves that they will be able to follow your blood counts and it's not for a doctor, it's not rocket science. It's pretty easy, but they have to be able to take your blood counts and then know what to do if something happens. And you have to, if you have a PMD, a regular doctor, you have to talk to them and say, is it okay? How are you going to monitor me? This and that. It's but like Cassandra's saying, once you've been on it, then they can spread out if you as an adult, they can spread out your monitoring just because you're not put on any weight and it's the same dose and it's unusual for you to have to change a dose in an adult unless they get sick or something like that.
Um, there's another hydroxyurea question here. This person said, I stopped taking hydroxyurea 8 years ago because it was causing low blood count that led to a transfusion every 3 weeks.
You're on too high a dose.
too high a dose.
Yeah.
So,
That's why
and
you need,
that just goes to show why those labs are needed regularly.
yeah,
Because you're once you get a dose, your dose might be different next year. You know, your dose is based on off of your weight and a whole bunch of other factors. And so when I started hydroxyurea, I was taking 3 capsules and now I'm taking one day and two the other day. And it's like 1, 2, 1, 2, 1, 2. So your dose will change, and that's why hydroxyurea needs to be monitored.
right. And it can lower your red count and it can also lower your white blood cell count. So um you can become what's called neutropenic or more susceptible to infections.
Okay.
And it's related to dose. It's like if your hemoglobin goes down where you need a transfusion, you're on too high a dose. So I can recall one adult who came to the our program who was on too high a dose and needed a transfusion and was kind of sick. It took us a while to get her back to where she should have been, but
Yeah. Um, Idiopathic epilepsy can be caused by sickle cell.
can what?
Idiop
Epilepsy.
Idiopathic epil
Idiopathy. Oh, that's epilepsy where nobody knows why you have it.
Okay. Can that
Can
be
you?
caused by sickle cell?
No. Uh,
No.
well, I mean, no, probably not. The thing with sickle cell disease is everything that happens to you medically can't be the sickle cell is not responsible for it always. So,
Yeah.
and doctors do the same thing. Oh, you've got some kind of problem, and I'm sure it's your sickle cell disease. And it really is not your sickle cell disease. You can't blame everything on your sickle cell disease. People with sickle cell disease have other associated medical problems that have nothing to do with their sickle cell disease, and having epilepsy would fall kind of in that category.
Yeah. Somebody said they stopped taking hydroxyurea due to hair loss. Um, and that's a personal choice.
Yeah.
I the hair loss didn't or the thought of losing my hair didn't outweigh the protection that I had for my organs. So it's like hair or organs. And so it is a personal choice at the end of the day. Like you're not at fault for any choice that you make. Whatever's important to you is important to you. But for me, I would rather lose. I can live without my hair, but I can't really live without my organs. So that was kind of how I reasoned with that in my head. Um, do you think there can be permanent pain in the bone after a crisis?
Yes, if you have bone,
Permanent damage, maybe, is or
yeah,
chronic
you
pain,
can have
maybe?
permanent bone damage from a really severe uh, uh, pain episode. A bone infarct is what it would be called. And avascular necrosis of the hip is bone infarcts from sickle cell disease. So you can have bone infarcts in your femur, and you could have pain after the resolution of your major vaso-occlusive episode. If it was persistent, like weeks later, then you might want to, it would have to be an MRI to see if it was a bone infarct in your marrow. But it would be something I would be concerned about because you shouldn't. An infarct should heal over a period of weeks.
All right. Any thoughts? Um, oh, do people with sickle cell trait experience crisis or other problems?
With sickle cell trait,
Mhm.
they do have problems, but they don't have sickle cell pain events. Some people who have been told they have sickle cell trait and think they do, but maybe have S beta zero thalassemia with a very high level of hemoglobin. Those people could, so if you have sickle cell trait and you're having pain, then you need to have a definitive diagnosis. Make sure you really do have sickle cell trait at a center where they can evaluate your hemoglobin to make sure that you have trait. But having sickle cell trait can, lead to some problems over time. So people with sickle cell trait, especially if they have something, a comorbidity like diabetes, can have kidney problems. Um, People with sickle cell trait can have problems if they don't drink enough water. They can have increased hemolysis if they're exercising. Um, some people think that people with sickle cell trait can have increased blood clots, but the literature on that is kind of back and forth. Um, it's not definitive, but if you were going to have surgery or something like that, they would probably want to make sure that if there was a risk, that you didn't get a blood clot after surgery with sickle cell trait, depending on what the surgery was.
So the only what I would add to that is, sickle cell trait isn't largely researched as well. So there's a big question mark over a lot of sickle cell trait, but more research is needed. So a sickle cell trait isn't what I like to say is generally people with sickle cell trait don't experience symptoms, but it can happen with sickle cell trait. So, but yeah, more research is definitely needed surrounding sickle cell trait. I think different people have. I actually went to visit Detroit, and there's a lab called Functional Fluidics. It's a company who specializes in red blood cell health, and they did a study around sickle cell trait. And then I think Dr. Q, you taught me that different people have different levels of S within sickle cell trait too. Um, so it's definitely really interesting to, think about, different people having different levels of S within, their sickle cell trait and how that could potentially show up in different ways. And yeah, so it's hard to give such a definitive answer surrounding sickle cell trait when, the research not much research is currently available, but what most people think is that sickle cell trait broadly is asymptomatic, but there are some complications associated with sickle cell trait. Renal medullary carcinoma is a very, very rare but aggressive cancer that can be found within people with sickle cell trait. And then, there's rhabdomyolysis if you're exercising and it's that muscle breakdown and you're dehydrated and it's hot and you're overexerted. That's a recipe for disaster. So it's not that you are, scot-free with it. There are definitely things you have to take into account. You have to drink also a lot of water and to protect your kidneys. But for the most part, people don't usually um, talk too much about pain. And then, like Dr. Q says, a lot of people get misdiagnosed and really do have sickle cell disease, but have been diagnosed with sickle cell trait. So, yeah. Is there a correlation between osteoporosis and sickle cell? If so, has teriparatide been used as treatment?
Uh, that I think people with sickle cell disease can get osteoporosis. I don't think it's directly related to sickle cell disease. Um, and there are different treatments for osteoporosis, and I think that that would be something you'd have to talk to your uh, personal physician or your healthcare provider about what would be the best for you if you do have osteoporosis.
Um, any tips or advice for what to do on severe jaundice for a 12-year-old male?
Well, if you have, well, first of all, you have to make sure you don't have liver disease because liver disease will cause uh, severe jaundice. I mean, I don't, severe jaundice where the white parts of your eyes look really yellow, and even your skin, the palms of your hands start looking yellow. Then you have to make sure that you don't have liver disease because that will cause jaundice. From uh, and jaundice outside of that is caused by hemolysis. It means people with sickle cell disease or red blood cells are becoming sickled, unsickled, sickled, unsickled, depending on the oxygen level. And so, and the sickle cell itself damages the red cell membrane, and so you have hemolysis. And hemolysis, or the red cell breaking apart and releasing the hemoglobin in the metabolism of hemoglobin in your body, it causes increased bilirubin and jaundice. So if you have sickle cell disease and you have jaundice, that's an indication you're having a lot of hemolysis. And if you're not, if you're, it it might actually, depending on whether the other things that are happening to you, it might be an indication for you to be on like hydroxyurea. Hydroxyurea would decrease hemolysis. That sounds like a pretty um, radical thing to do if you have hemolysis, but that would do it. Drinking a lot of water and stuff like that generally does not decrease jaundice. It's the hemolysis that's doing it. And then you got to just talk to your physician, make sure that it is your sickle cell and hemolysis rather than something else.
Dr. Q, what are your thoughts on even flow?
I thought that was answered last week. No, even flow is, I said this the last time we were on. I got in touch with the people. I wrote a letter to the people with even flow because they say it's been proven in studies or something like that. And I said, well, I'm a doctor. I'd like to know what the studies are. I'd just like to take a look at them so I can, if it really works, hey, that's great. But they wouldn't tell me what studies or anything like that. So even flow, I don't know if it's bad for you, but I don't think it's good for you. And there's a lot of placebo effect when you take a medication like that. So you might, until you have a vaso-occlusive episode, you might feel like you're
Ooh.
feeling better, but really you're just feeling good because you think you're doing something good for yourself. But I don't think there's a study or anything that says that people who take even flow have fewer episodes of pain. If they did, if even flow worked the way they said it did, they would sell their company to a big pharmaceutical company and make a lot of money. So um, that's my take on even flow.
The placebo effect is real, guys. That
Yeah, it
stuff
really
is
is.
real. Like, and it's not bad because if you are feeling better, right? That's all we need at the end of the day.
Right. You're feeling better, but your sickle cell is not getting
That's the
better.
thing. But your sickle cell is still sickle selling, right?
Yeah.
But I don't know. It's really interesting, the placebo effect.
Yeah. There's also something called a nocebo effect, where you take something that
And
you think,
nothing you don't.
well, you think so, you take something you think it's not good for you, and sure enough, you feel sick from it. Just like when you take
I
something
I
that
think I do need a nocebo effect. That's what I think that's me. like I drink some alcohol and it's just like, oh my gosh, oh, no.
Oh man.
Uh, but yeah, so those are very, very real things. They
Yeah.
actually have placebos in a lot of clinical trials just to make sure that a drug is actually working. So that is a real thing. So people can take chlorophyll and it may or may not. I don't know. I don't think there's any studies around chlorophyll and sickle cell, so we don't know. But, somebody could swear by and say, yeah, this helped me feel good. And that's because in their brain, they're already saying, this will help me, this will help me. And so your body reacts to that. So it's really interesting. We should probably tap into that a little bit more for sickle cell
Oh
because the
yeah.
power of the mind.
And that's why in
Um,
a study they have, you have to have objective findings because the people on the placebo may feel better, and you can't really ask somebody, is this medicine working for you or not? You have to have how many vaso-occlusive episodes do they have? Is there something going on with their hemoglobin, if that's what's supposed to happen, that kind of thing. And that's why they have placebo in a study, because just giving a medicine to somebody is going to make them feel better, whether it's the active medication or just a sugar pill.
okay. Great, 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 great questions. I'm loving these questions. Can a crisis
I have one. Is paracetamol have a negative effect on people with sickle cell disease? In this country, we don't like to call people who have sickle cell disease sicklers, but I know they do in other countries.
Are you from Nigeria? Because in Nigeria we use that word all the time, like it's nothing.
So that's for people who don't know, that's acetaminophen, Tylenol. Yes, it doesn't necessarily taken as the package says you're supposed to take it, would not have a problem. But if you take too much acetaminophen, paracetamol, I think that's how it's pronounced, it can cause liver failure. So there have been people who overdose themselves on Tylenol or acetaminophen here that had liver failure and needed a liver transplant, or they died. So acetaminophen is not a benign. If you take it the way you're supposed, you'd have to take maybe 10 times more than what you were supposed to, but you could get really, really sick with acetaminophen. And that's why if a kid gets into a bottle of acetaminophen, Tylenol, don't think, oh, that's okay. It's just Tylenol. That's not okay. Tylenol has really bad. An overdose of Tylenol can be really, really bad.
And this
When I
person's
when
from
when I was when I was
Uganda.
in medical school, I was a nurse before I was a doctor, and I worked in the ICU when I was in medical school. And we had a young girl, maybe I can't remember. She was a teenager, but she took Tylenol to commit suicide. It was a suicide attempt, and but
Oh,
not really, because
wow.
I think she thought Tylenol, but she died from liver failure over a long period
Wow.
of time. Took weeks and weeks. She was really,
From
really
that
sick
one dose?
from taking like a bottle of Tylenol.
Wow. But it happened over time instead
Oh
of
yeah, it
just
doesn't happen. You don't. It's a very liver failure is really awful because it
oof.
detoxifies your blood. It affects your coagulation. Um, you get really sick if you have liver failure,
Yeah.
which
Can
is,
a
go ahead.
can
What?
a crisis cause brain damage?
Uh, boy, that's well. An infarct, you could say, like if you have a stroke with sickle cell disease, that is vaso-occlusion in your brain, in the circulation of your brain. So that is vaso-occlusion. If you have a vaso-occlusion in your leg or your chest, If you have acute chest syndrome, it is a risk factor for stroke. Um, but in and of itself, having pain in your arm, your leg, whatever, um, is is I can't say you would never have a stroke if you had, like an infarct in your femur or something like that. But it generally is not. However, people with hemoglobin SC disease, they can have they have a lot of they don't make as much they don't need to make as much blood as someone who has SS in order to maintain their hemoglobin. So there's a lot of fat in their bone marrow. So they can have bone marrow infarcts that release the fat from their bone marrow, and that goes throughout their body and can cause it can be catastrophic. So someone with SC disease who has like a really severe pain crisis, say in their femur or something like that, could go on to have really severe problems. And strokes is part of that whole uh, issue problem with having fat emboli throughout your whole body with SC disease. Doesn't really happen, so it can happen with SS, but not as often because people with SS, their bone marrow, it doesn't have that much fat. It's trying to make more blood. But in SC, they're more, like I have probably a lot of fat in my bone marrow.
So not typically would a crisis cause brain damage, but other stuff that are sickle cell related, other complications that are sickle cell
Yeah.
related could
Well,
cause brain
yeah,
damage.
and if you have a lot of strokes, or a lot of strokes, a lot of pain episodes, then you could have what are called silent infarcts. And a lot of people with sickle cell disease have silent infarcts. These are teeny little strokes. They're actually, to be a silent infarct, it has to be a certain size, but that have a lot of those. And they do affect your say like your ability to do well in school. They affect your intellectual functioning, and they can affect your decision making as well. So
Executive function.
executive function,
Yeah.
right? So if you and there was a study looking at people with silent infarcts, and they were a risk factor for having a larger infarct. Um, and some people recommend that just before entering school when kids are 5 or 6, they should
Mhm.
have a MRI scan just as a baseline to see if they have a lot of these silent infarcts or not. And I don't know that there's been a study. I haven't heard about it, but interestingly, a lot of kids with sickle cell disease need to have IEPs, individual educational programs, and some of them get psychological testing to help figure out what's going on. And the person who would know would be Michael DeBon, right? Um, I don't know if somebody has looked at those silent infarcts and then monitored whether or not those kids are the ones who need the most help in school. But over time, they may have an effect on people with sickle cell disease.
All right. Um, does hot compress help ease pain while in crisis?
It does because it vasodilates your vessels, and I think the warmth just makes it feel better. What you have to be careful about is if you're using a heating pad or whatever, that you don't burn yourself. It does happen. It I'm sure it happens at home, but it definitely does happen in the hospital where someone puts a heating pad on somebody who has sickle cell disease, and they kind of forget about it or don't check it, and the person gets a first or second degree burn from the heating pad. Doesn't happen very often, but it definitely is a problem with heating pads, especially if you
I
like were to go to sleep with the heating pad on all
my
night.
heating pad is my best friend. That's my best friend right there. I don't
Watch
travel
out they
without
don't burn you though.
I don't travel without her. I don't sleep without her. I don't live without her. Um, and I have multiple heating pads. And I have a weighted one. The
Oh,
weighted one is
wow.
the best. That one, it has the glass beads in it. It just feels like a warm hug. And I love it so much. It's my most treasured uh thing that I own.
So
All
that's
right.
they have like weighted blankets for people who
Yeah.
yeah, they people like those. It's like getting a big hug.
Yes, I love it. I love being warm and comfortable and
Yeah.
around soft stuff. I love being cozy.
Don't divulge too
Anyway.
many of your secrets.
I know, right? I know, I know. Maybe I love the feeling of being in the womb still, and I'm a whole
Oh,
38 years
yeah.
old.
That's what we all want to do, be back
Yeah,
in
just
that nice,
go
warm,
back
dark
into the
place.
womb. Uh, all right, these are such great questions. Are there adverse effects from Prozac long term in patients with sickle cell?
Prozac? I, I, I've, I don't know. I'm sure if you take Prozac long term, there's side effects, but I'm not sure. I don't know about Prozac. That's something to ask your provider, whoever gave you the prescription or whoever's, is there a problem with this? I'd have to look it up. I don't know it off the top of my head.
Yeah.
I'm sure there is, but I don't know what it would be.
Oh, I love to hear that you guys have a heating pad too. I have her beside me right now. I should have a, I have one that doesn't even plug in. It's like portable. Like I
Oh,
just,
wow.
yeah, it has a rechargeable little battery thing. And yeah,
There you
yeah,
go.
that's how serious I am about heating pads.
That's what you need in the car when you're
All right. Oh, here's a question that just came in. Any advice on avascular necrosis? What
well,
kind of advice are you looking for? Like to get a hip replacement or some sort of replacement? I had avascular necrosis. And it's common within
yeah,
sickle cell. Yeah.
about 20% of people with sickle cell have osteonecrosis. So it's extremely painful. If you don't do anything about it, eventually the head of your femur, which is the part of the part of the hip bone that where your femur and your acetabulum, this is your hip, this is your pelvis and your hip bone, and it goes like this. After a long time, if you don't do anything, you're terrified of surgery, that will fuse. So the femur will fuse into your hip, and then you don't have any mobility. But the pain goes away because the pain is caused by the inflammation of the bone. You'd like to get a hip replacement before that. Still can have a hip replacement, but you'd like to have a hip replacement before that. So whether or not you get a hip replacement is up to you. Um, when the pain is so bad that you can't, walk or do things that you really want to do, and it's there all the time, then that's a time to get a hip replacement. Hip replacement, Cassandra knows all about more than I do about it, but
Oh,
it's
so
it's
yeah,
kind
she's
of a
saying
big,
I'm only 24. She's only 20. That's when I got my hip replacement when I
yeah.
was 20. It was 2013. When I was 25, I got my hip replacement when I was 25. And yeah, it's kind of sad because you're so young, but and I was the young my doctor's youngest patient. So, yeah. I have it on almost all my joints. I had a hip replacement 2 years ago, but now I need my elbows replaced. I just want to know, is joint replacement my only option? Hmm.
I think if you want to have mobility and decrease pain, I can't think of anything else. That
Anything
there
else?
for in your hip, there is something called a core decompression where they drill a hole through your femur into the head of your femur, and that can decrease the pain, but it's temporary. It doesn't last. Depends on the person, but it doesn't last for a long time. And people who have core decompressions end up getting hip replacement anyway. In other joints, um,
Yeah, I've
you
never
know,
heard about it in elbows before.
yeah, they don't do that kind of thing. Some people, if you go to an orthopedic surgeon, some people will put steroids in the joint capsule, which decreases inflammation, which helps a little bit. But eventually, the way you cure or get rid of the pain permanently would be a replacement.
Hmm.
That's Unfortunately, that's the right now. Maybe in the future there'll be something different, but right now
She
that's
says
the
she has
only.
AVN on her knees too.
Yeah, people have, shoulder replacements, hip replacements, knee replacements. I don't know.
Yeah,
I'm not, I don't know enough about orthopedic surgery to know what all the issues can be with all those kinds of things, but
yeah.
they're all available.
So sorry to hear that, and I
Yeah,
hope you're
that's really
getting
awful.
some sort of pain relief. I know I did the cortisol shots to
Right.
help with pain, but that's only a band-aid, unfortunately. You kind of have to address the root cause, and I think that's replacement, unfortunately. I am SC and I have hemoglobin SC disease. I'm trying to see if that is a part of a different question. Um, can anyone explain for me? Because they're saying it's not full blown, but it's also not AS. Yeah, so think of the term sickle cell disease, and there are different types of sickle cell diseases. There's SS, there's SC, there's S beta thal 0, there's S beta thal plus, there's SD, there's SO, there's SC. There's a ton of different types of sickle cell diseases. Now, the most common sickle cell diseases are SS, SC, and sickle beta 0 and sickle beta plus. Those are the most common type. In a textbook, it might say that SS is the most severe type of sickle cell disease. However, that isn't always necessarily the case and really should be on an individualized basis. Your sickle cell severity should be considered on an individualized basis. I have SS. Last time I was in the hospital, last time I got admitted to the hospital was 2017. But I have a friend that's SC and they're in the hospital a lot more often than me. So they, in a textbook, they might say SC is more mild than SS, but that doesn't necessarily have to be true. It really should be more individualized to you, and you should consider your health history as opposed to your genotype. So,
Yes, I had a little, not even a teenager, who had S beta plus thalassemia, who had avascular necrosis. We, I don't know that we ever investigated, or the orthopedic surgeon ever investigated that there was a secondary cause for that. But so the severity of sickle cell disease is independent sometimes of what the actual diagnosis is. And people with the same diagnosis can have completely different outcomes.
that's a little bit about what I learned. I was at a company called Functional Fluidics, and I talked a little bit about this earlier, but they do blood health. And did you all know that it's more than just SS and SC, but your red blood cell could have a different level of stickiness. So they could stick to the walls of your blood vessels. um, there's like a range where it's at, it's between 200 and 400, where, that range is like you have high adhesion or you had high stickiness of your red blood cell. And so there's that factor. There's another factor with, how flexible your red blood cell is. There's like just so many other different factors that determine how severe your disease is. And so looking at the genotype isn't the best way to determine how severe your sickle cell is, but rather looking at, how many VOCs you have, how many times you're hospitalized, looking at your red cell health as well, understanding all of those things to better determine how severe your sickle cell is.
And how much hemolysis you have. Like some
Mm.
people have
The
less
breakdown
hemolysis
of your
than
red blood
yeah.
cells,
Yeah.
how fast they break down, right? So hopefully that's helpful. AS is sickle cell trait, and that's not the disease at all. So that's the trait, and then the rest of them are the diseases.
And there are lots of rare hemoglobins that, when they're combined with hemoglobin S, are equivalent to sickle cell SS.
So yeah, sickle cell is so complex, guys. There's just so many different types. Greetings from the Dominican Republic. Can I come visit you? I am a clinical and an administrative educator specializing in sickle cell anemia. Hey, it's great and a pleasure to meet you. Great to meet you too, Stanley.
Yeah.
Thanks for your message. What's the normal hemoglobin for a person with sickle cell disease? I know
It,
so everybody has their own baseline, but
right.
yeah.
So some people, I think most people with hemoglobin SS or estimated zero thal have a hemoglobin that's 9 or less. If people with SC disease have hemoglobins that are more normal, like around 12, 13. Um, but the degree of it, well, like what we were talking about, the degree of your hemoglobin depends on how much hemolysis you're having. So if you have more hemolysis, you're going to have a lower hemoglobin. And there are people who, like what Cassandra's talking about, who have very low hemoglobins and a lot of hemolysis. And in the mainstream kind of studies, no, I'm not sure that's very well understood why some people have more hemolysis than other people. I don't know, but I probably somebody else that studies blood and takes care of sickle cell knows.
All right, I have time for one more question. If I didn't get to your question, ask it now and hopefully we'll go ahead and get to it. But really great questions today. You all are very sophisticated. Um, and I'll read this comment from Stanley while anybody wants to put in their last question. We need to create more awareness, sensitivity, prevention, and education about sickle cell anemia, more comprehensive care, better services, and better access to quality health services. Dominican Republic is so lucky to have you. You are absolutely
Yep.
right. You are preaching to the choir, Stanley. We agree wholeheartedly. I'm gonna pin that there. I see our last question came in. What should a person do immediately while in crisis and baseline advice?
Well, I think the first thing would be to really try to get as well hydrated as you possibly can. And the second thing would be to start taking your medication, whatever it is that you have for your pain episode. And then do what Cassandra was talking about, heating pads, some kind of other thing that works for you when you're in pain. Some people like distraction. They listen to music, they play video games, whatever. Um, and I think most, you know, I think Cassandra might agree with this, but I think most people know what their usual pain episode is like, and they know, okay, this is like, I can't do this anymore at home, and then they end up going to the emergency room. Um, but I think, hydration, take your meds early, uh, take an anti-inflammatory along with an opioid, use if it's an extremity heating pad or something might be good, and then some kind of distraction. Or some people, I think, just like to be real quiet and uh, not, and they just don't, they just want to be kind of left alone. But there's really, besides that, there's, I don't think it's generally possible, Cassandra would know, but to determine at the beginning of a pain episode whether you're going to end up in the hospital or not. As it progresses, you realize, oh, this is not working at home.
If you have a crisis and a fever, then get to
Oh,
the hospital.
yes. Chest pain, fever. If you have pain, chest pain, fever, you have a high probability that you have acute chest syndrome, which you need to get to the hospital like ASAP. So
Um, can you answer the normal hemoglobin question again? So, everybody has their own baseline hemoglobin. Usually SS is around what, 7, 8, 9. And then if you have SC, the hemoglobin can be higher, like 12. Is that what you said, Dr. Q?
yeah, yeah, 12, 13.
Yeah. So it depends on your genotype. Um, but like for example, my baseline hemoglobin is around like 8, 8.2, 8.4. So knowing your baseline is actually important. So, but I think
And
my sister's, she has the same genotype as me. Hers is like her baseline is like 7. So there
right,
it really varies from person to person.
right. When we did exchange transfusion with apheresis, so these are people who are getting exchange transfusions every single month. Um, and some people would come in with a hemoglobin of 9. Other people would come in with a hemoglobin of 6 or low, or I don't know if anyone came with 5, but definitely 6. So within that 1 month period, some people really didn't change that much because they didn't have very much hemolysis, and other people changed a lot. So it's very individualized. And I'm not sure that there's been studies to look at why some people have lower hemoglobin and more hemolysis than other people, besides just, everybody say with SS. Within SS, there's just a range there's even people with SS who have relatively high hemoglobins, 9 all the time.
All right, Dr. Q, do you want to give us your special statement?
Yes, this is my opinion. I'm not trying to give you any advice that, or, to, or push any kind of medications like hydroxyurea, crizanlizumab, whatever. And I could be wrong. I'm doing this right off the top of my head. And this is really, Sickle Cell 101 is all about information. So I try to frame my answers as providing information and not really giving advice. Although it may sound like advice, I just want to give you information so that you can make intelligent choices about your sickle cell disease.
All
And
right.
if you didn't have a chance, you can always write to Ask Sickle Cell 101 and I'll answer your question
Just
in
ask at
in an email. Yeah,
sc101.org.
yeah.
Yeah. All right, you all, thank you so much
Okay,
for joining us this
thank you.
Friday. Hope you have a
Bye-bye,
wonderful
everybody. Have a nice
weekend. Take
holiday.
care.
Bye-bye.
Bye.